Hi, my name is Ali Pramada, and this presentation will be about fetal alcohol syndrome. The case study is about a 6-year-old girl named Layla. She's a Caucasian female. Her birthday is June 1st, 2017. She's been diagnosed with fetal alcohol syndrome, and she'll be starting kindergarten in fall 2023. Her dad is a single parent who has full custody, and some of his concerns are that she struggles with attention, executive functioning, ADLs such as dressing, and school readiness. Layla's inability to manage clothing fasteners is a predicted concern area because children with fetal alcohol syndrome tend to have gross and fine motor delays because of abnormal muscle tone, poor manual dexterity, and challenges with coordination as a result of damage to the motor cortex in utero. Layla's challenges with tabletop activities are a predicted concern area because children with fetal alcohol syndrome have underdeveloped prefrontal and temporal lobes, which negatively impact their ability to attend to a task, self-regulate, and process information. Additionally, children with fetal alcohol syndrome have differences in their motor cortex, as well as abnormal tone like hypertonia or hypotonia, which hinder their ability to sit upright at a desk for a sustained period of time to engage in fine motor activities. Layla's strengths are that she is resilient, determined, and follows a structured routine very well. Children who struggle with daily activities may develop a learned resiliency from their experiences and challenges. Children with any developmental delay seek assistance to be successful in tasks. Children with fetal alcohol syndrome benefit from structured routines and visual schedules to stay on task and maintain appropriate emotional regulation, particularly when transitioning from one activity to another at home or at the classroom. This slide covers underlying factors and characteristics of the diagnosis. So one of the factors is social skills and communication. At least 20% of children with fetal alcohol syndrome have a hearing impairment, and 90% of children with fetal alcohol syndrome have speech deficits. This makes communicating with others extremely difficult when combined with other facets of FAS, including impulsivity and decision-making skills. Additionally, because Layla is preparing to go to school this coming fall and has limited social play opportunities because she has no other siblings or neighborhood peers, the treatment plan should include these focus areas to enhance her ability to engage in the kindergarten classroom. Another characteristic of fetal alcohol syndrome is having an intellectual disability. Because FAS causes learning disabilities, decreased attention and memory, and poor impulse control, many children with this condition have significant challenges in school and require academic interventions. It is important to prepare Layla for beginning kindergarten this fall and to determine which supports may be beneficial to include in the classroom and a potential IEP. Lastly, one of the characteristics for FAS is sleep disturbances. Research supports that between 58 to 85% of clients with FAS experience sleep disturbances. These include trouble falling asleep or staying asleep, breathing issues, and feeling less rested throughout the day. Sleep impacts not only Layla, but also her father. It is important to assess both the child and parent sleep hygiene, as it can impact both individuals' mental and physical health. The developmental frame of reference focuses on the progression through specific stages of development and provides guidelines for goals and intervention to meet the child where they are developmentally speaking. This frame of reference also incorporates the use of the Just Right challenge by allowing the skills to be met in a sequence that compares to typical developmental school and skills and draws on the child's strengths and preferences while also providing opportunities for challenges and growth. This is an appropriate frame of reference for Layla, as she is suspected to be developmentally delayed with gross and fine motor skills. The sensory integration frame of reference focuses on how the interaction among sensory systems, such as auditory, vestibular, proprioceptive, tactile, and visual systems, impact a child's learning and behaviors. This frame of reference supports how sensory modulation, sensory discrimination, postural ocular control, praxis, bilateral integration, and sequencing relate to function. This is an appropriate frame of reference for Layla because she has difficulty with attention and is likely to have sensory processing issues because of her condition. The sensory profile 2 is used as a top-down assessment because the assessment focuses on how sensory processing impacts a child's function at home, school, or in the community based on the caregiver's reports and questionnaire answers. This assessment will be suitable for Layla as her father can provide his input on her behavior to sensory events and help the OT to have a better understanding of what type of sensory stimuli helps or hinders Layla's occupational performance. One of the bottom-up assessments chosen is the BOT2. This assessment provides an inclusive overview of gross and fine motor skills that impact function and occupational performance. The test can be administered as a short form for only 15 to 20 minutes, which is helpful considering Layla's age and limited attention span. Additionally, the standardized assessment will support eligibility and insurance coverage of occupational therapy services as a norm reference assessment. Lastly, the BOT2 is an appropriate assessment for Layla because it provides a variety of developmentally relevant tasks, such as cutting with scissors, running, and stringing beads. This will provide the OT to set client-centered therapeutic goals and interventions. OT interventions will focus on hand strengthening and improved bilateral coordination by engaging Layla in a variety of activities such as hanging from monkey bars and reaching across midline. These activities will support improved performance in functional activities such as using scissors and managing clothing fasteners. OT interventions will also focus on improving sensory processing skills, sensory modulation, and executive functioning skills by engaging Layla in a variety of activities such as puzzles and obstacle courses. Interventions will also focus on identifying beneficial supports such as wearing headphones or using a visual aid to enhance Layla's engagement in tabletop activities in the classroom or outside play activities with peers during recess. One of Layla's long-term goals is that within 1 year, she will demonstrate the ability to independently dress herself at home and school, including the ability to manage clothing fasteners such as buttons and zippers. This will be broken down into smaller steps. So for example, one of the short-term goals is to be able to zip up her jacket after someone else has helped her with orienting the right position. Another short-term goal to support the long-term goal is that she'll be able to button 1 out of 3 buttons. So these kind of break down the big goal into small steps that are still focused on the dressing occupation. The second long-term goal is that within 1 year, Layla will complete a 3-step tabletop activity, including coloring, cutting, and gluing independently in order to demonstrate improved attention, sensory processing, and fine motor skills necessary for successful classroom engagement. So this long-term goal will be broken up into 2 smaller goals. One of the smaller goals is that she'll be able to sit upright at her desk and she'll have appropriate postural control and she'll be able to complete a coloring activity for 5 minutes. The other short-term goal that breaks this down even more is that she'll complete a beading activity with stringing 3 out of 4 beads at her desk and she'll be able to remember the specific color pattern. So this goal implements certain bilateral coordination skills, sequencing, sensory processing, all those type of things that we're working on in the long-term goal. This concludes the case study on Layla, a child diagnosed with fetal alcohol syndrome. Thanks for watching.